Hello Insta family, it's Dr. T here on Tuesday night and we've got a rapid fire Q&A, so I hope you guys are jumping on. I hope you've had a great week. It's a little chilly outside today here in Perth, so I'm looking forward to putting my feet up. How are you guys doing? I hope you've had a great week. So if you have, everyone's jumping on, fabulous to see. If you have any questions, now is your opportunity to post them in the comments, and just remember what our little guidelines are. So try and make your questions as generic as possible. Don't need to hear your life story. Won't be doing any personal diagnosing online here. So the more generic the questions, the more applicable the answers are to everyone else. And I'm going to try, though I'm not very good at this, to make them as short and sweet and generalized as I possibly can. Just waiting for a question. It's been a topsy-turvy old week, hasn't it? I've got to share a little secret with you. I am a little bit of a monarchist, and it has made me really sad to hear about Queen Elizabeth II this week. And I've been following the story really closely, and I think what I most admired about her was how she handled everything with such grace and style. And I think we queens, we fertility queens, we IVF queens, we can probably learn something about that, handling things with grace and style. So that's the one thing that I've really learned from the Queen. If there is any generic questions about fertility, about women's health, let's talk about them. Actually, while I'm waiting, I do want to talk about the concept of couple infertility. I've seen a few people over the last couple of weeks who've come to see me to investigate their fertility, but they've come on their own, and they are in a relationship. They are part of a couple, and I'm talking about couples, male and female couples. And I think one thing I really want to get across to as many people as I can is the concept that fertility is, generally speaking, a couple thing, right? And so it might be all very well for me to work a woman up for fertility, but I'm really only doing half of the job. And that's really the big message, is that about 15 up to 20% of infertility is actually male related. And many of the things around fertility, you need to investigate both the male and the female. I can't say to someone, oh, I've sorted out your fertility as a woman, see you later, you're fine. When in fact, fertility is a couple things. So it's really important to make sure that you're coming as a couple. Now, of course, if you're in a same-sex relationship, or if you're a single woman, or even if you're a single man, by virtue of being in a same-sex relationship or being a single woman, I suppose technically you have infertility, don't you? And so that's when we're looking at fertility treatment. But to do a workup to see if someone is fertile or not, you actually really need to be working up the couple. Now, of course, I've got some questions here. So, fantastic. Nita, I prefer not to have DMs. I don't do consultation using social media. So if you have questions that you want answered pertaining to medical advice, then you need to come and see me, just like any medical practitioner would say. All right. Can you do a natural FET cycle, or do you have to take hormones? Great question. Look, there are different types of frozen embryo transfer cycles. Broadly speaking, you have a natural cycle, and that would be where we track your cycle, we watch your own natural hormones, we wait for a surge, and then we count forward and transfer the embryo in that window of implantation. Now, the only problem with doing it completely naturally is you've got to pay really close attention as to exactly when ovulation occurs, of course. And the only way that we can do that is watch for the surge. And sometimes we miss it because we're not doing blood tests every single day. Most fertility centres don't do bloods 7 days a week. And so we will generally fabricate the LH surge by giving you a trigger injection. So to do a truly natural cycle is actually quite challenging, particularly if your LH surge occurs over the weekend, for example. Now, you can assume, if you miss it in a blood test, you can assume when that surge and therefore ovulation, which occurs 12 to 24 hours after, occurs, but then you're actually, I guess, guesstimating, so you're backdating. But it can be done. The other way you do it is what we call a modified natural cycle, where we might give a little bit of stimulation and then do a trigger. And then there is a hormone replacement, FET, where we actually provide you with the estrogen and progesterone. So they're very broadly the categories. And so, yes, you could technically do a natural cycle, FET. Many fertility specialists like to have a little bit of control and give support, because there's always the theory that, okay, there might be something going on with the ovulatory cycle that is actually impacting on your ability to conceive. So great question there. Can you do IVF even if you're a healthy couple? Of course. Of course. In fact, I would want all couples to be healthy before proceeding with IVF. They need to, their temples need to be in the best possible conditions. So that includes, weight management, non-smoking, making sure you're just doing an optimal amount of exercise, not too much, not too little, taking folic acid to ensure that you've got that fortified folic acid in your diet. So absolutely, I would want you to be healthy. Can you do IVF if you're not infertile? Well, technically, no, you can't. You have to have proven infertility in order to create embryos. So you can't just create embryos because you feel like it. You actually have to have a reason. All right, good questions, guys. Good questions. Anybody else? Come on. There's got to be more questions. I know there must be more questions because there's lots of people online. Has anybody else got a question for me? What else? What else can I share with you? What else can I share with you? I wanted to speak specifically to that concept of couple infertility. Oh, here we go. What is an optimal amount of exercise for trying to conceive? Oh gosh, I was trying to be purposely vague on that one because I don't actually think we have any set evidence base around that, other than to say that moderation in this is vitally important. We know that when someone does a reasonably high amount of high intensity physical activity, so when you're sort of really pushing your body quite hard, high perceived rate of exertion, you can obviously induce those endorphins. And endorphins, which makes us feel fabulous, can also inhibit your own HPO axis or your ovulatory cycle. So we've got to be careful that we're not overdoing it. So there is some guidelines. I'm trying for the life of me to remember what the name of the website is. I think it's yourfertility.com.au. That talks about sort of doing 4 sessions of moderate intensity, huff and puff, perhaps for about 30 minutes a time, is probably the recommended amount of physical activity. Most definitely 10 CrossFit classes a week is not, and doing nothing is also not ideal either. So I guess it's not too much, not too little, but just right is probably the optimal amount. Is exercise okay after a transfer? How long should you leave it? Again, we have no evidence to say that you can't go and do physical activity, but I probably wouldn't be going and doing a Bikram yoga session where you're going to put your core body temperature up, significantly dehydrate yourself. I think, going for a moderate level sort of huff and puff walk is perfectly reasonable. It's probably not the time to go and do your triathlon training, for example. So, but great question, and we don't have any really set information. What I do know is that exercise, moderate level exercise, is not harmful after you've had a transfer. Can a couple only have a successful pregnancy with IVF What? Can a couple only have a successful pregnancy with IVF and always miscarries with natural spontaneous? I think I understand the question. So if someone is having, I think I understand what you're asking is, if somebody has recurrent miscarriage with spontaneous pregnancies, can they be successful with IVF? Well, IVF itself is probably not treatment of recurrent miscarriage, if that makes sense. The value of moving to something like IVF is the ability to test the chromosomal status of the embryos before transferring them. So that would be where the true value of IVF, and probably then contracting the time to a successful ongoing pregnancy. So that's where I would see the value of doing IVF in the context of recurrent miscarriage. Good question. I think if I've answered the question that you've actually asked me. I think, did I miss any others? No, we've talked about exercise. We talked about miscarriage. We've talked about being healthy, the types of FET cycles. Any more questions? A couple more minutes before I wrap it up and go and put my warm, comfy jumper on for the evening. Any more questions, guys? Keep them short, keep them simple, keep them generic if you can. These ones that you've shared with me are great, and I know there'll be more than just one other person that would have had benefit from these answers. Oh, anyone else rolling down towards the school? Can you colour your hair when pregnant? Oh, that's such a great question. Can you colour your hair? Well, of course you can. We don't know, however, the impact of hair dyes. We do know that hair dyes contain endocrine disruptors, and that endocrine disruptors can be problematic with pregnancy, and more probably with the health of the offspring. So is it recommended to do or not recommended to do hair dyes? I don't think there's any hard and fast rules about it. There's plenty of women who choose not to dye their hair while they're going through IVF, but I don't think we have any randomized control trial evidence to show that it's bad for us. Is there a wait list for donor sperm? Yes, Jessica Rabbit. Many clinics who offer sperm donation treatment will have a wait list, and what you're talking about is unknown sperm donation, so a donor registry. And each clinic will have their own length of wait time depending on where they're able to access their sperm from, and it can vary anything from sort of 6 months up to 18 months. What you need to understand with donation is that there is obligatory counselling and cooling off periods and wait times that must be undertaken anyway. But the best thing to do is to approach a clinic and find out from their donor coordinator how long the wait is. How is the frozen embryo to be transferred chosen? Oh, great question. So embryologists are our experts in grading embryos. Different clinics use different grading systems. The most, I guess, common and well utilised one is the Gardner grading system. And generally speaking, labs will, I guess, rank those embryos. Some people use embryo scopes to give a bit more detail to help in that deselection process. And then they'll just move through from the highest grade to the lowest grade in transferring embryos. So that's a really, really good question. What can you do to have the best chance of success with FET? What can you do? Don't smoke. Don't drink. Just do moderate level activity. Make sure you're taking your folic acid. Try and relax, though extremely hard to do, but, really not letting those stress hormones ramp up. Get lots of sleep. I'm trying to think of this other things that you can do. There's lots of different opinions on to have sex or not to have sex. It's certainly not harmful to have sex. Yeah. I think they're probably the only things. Have someone who's good at doing transfers. Do you transfer? choose the best embryo to transfer. I mean, they're all things that we do within the fertility setting. But from the perspective of what you can do, I think just live a really moderate life. Don't smoke. And take your folic acid. They're the main things I'd recommend. I know it sounds just too contrived, doesn't it? But really, it's just getting the basics right. How effective is myo-inositol and melatonin? Myo-inositol, there is no evidence. People substitute in myo-inositol for metformin because the side effect profile, the gut upset is thought to be a little bit less, but there is no strong evidence on myo. And melatonin, again, we think it is used as a powerful antioxidant to, I guess, try and improve egg quality, but the levels of evidence are really quite low. It is used as a jet lag drug, and I guess that's how it was found to perhaps potentially be related to improving egg quality, but the evidence is still really out on that. Suggestions on what testing to get done after recurrent pregnancy loss, 3 losses. Yeah, so 50% of the time we don't find a cause. Of the ones we do find a cause, 50% of them are due to chromosomal abnormalities in the embryo. And within that group, about 5 to 7% of them are inherited from the parents. And so doing your chromosomes and your partner's chromosomes is really important. Doing an endocrine screen, looking at things like thyroid function and prolactin and insulin resistance. Making sure there's a good anatomy survey, so having a good 3-dimensional ultrasound, checking for polyps, checking for fibroids, perhaps considering whether there's a luteal phase defect. Looking at the thrombophilia screen, so heritable clotting abnormalities or risks of antiphospholipid syndrome. They're kind of the main things, and then you start to get into the weird and wonderful immunological stuff. But if someone has had 3 miscarriages, I would be starting with those things first. If someone has had sort of 7, 8, 9 miscarriages, that's when you start to look at some of the weird and wonderful things. But I certainly would start with the things that I have mentioned. Great questions. 2 more questions I'm going to finish off with. Thoughts on how useful PGM, I think you mean PGTM is, Ashlyn McKenna. Pre-implantation genetic testing for heritable mutations. So how useful do I think it is? I think that if you are wanting to avoid that particular disease in a child, then it's fundamental. And that's it. I mean, that's what pre-implantation genetic testing was designed for, was to reduce disease burden in our children for known genetic conditions. Tyne 232, thoughts on NAC for endo. I think the evidence is still growing for NAC and its benefit on endo, but I do think biologically it seems plausible because endo is an inflammatory condition and NAC is thought to sort of have anti-inflammatory properties. But again, no big randomized controlled trials on this stuff yet. So watch this space. Guys, I loved it. The questions were flooding towards the end. Really good stuff. Thank you so much for joining me tonight. It's been fabulous. We've been through so much. Here's to Queen Elizabeth. May she rest in peace with all her style and grace. And may you all move forward with your journeys with the same style and grace. Next week will be our last one before the school holidays, and then I'm taking a break for a couple of weeks. So I will see you next Tuesday. Have a wonderful week. See you soon.